I have almost never seen jaw pain that is related to pterygoid dysfunction not go away. Clicking, popping, locking, any of that stuff can be highly related to dysfunctional pterygoid tension. And these muscles attach on the inside of the condyle of your jaw, and they run in and attach basically behind your face. They attach to your skull from the inside. So there's a really weird muscle that may be causing your jaw pain. I'm talking about the pterygoid muscle, or the medial and lateral pterygoid muscle if we want to get really specific. And these muscles attach on the inside of the condyle of your jaw, and they run in and attach basically behind your face. They attach to your skull from the inside. And when this muscle contracts, what it actually does is pulls your jaw the opposite direction. So for me to pull my jaw to the left, I contract my right pterygoid muscles. And when these stay tight, what'll happen is they basically will keep my jaw offline. So if I only have tightness on the right side, then what'll happen is I will end up getting into a position where my jaw kind of stays twisted a little bit. Sorry, Skelly. Because I've got more tension here, keeping my jaw pulled over there. And so what happens here is I stretch the capsule of the right side of my jaw, so basically get like a capsular strain, and I compress the joint on the left side. And so when I'm doing this, I will start to get pain on either side because that muscle is not allowing proper motion of the jaw. And if we just release the tension out of it, my jaw will fall back into neutral and I'll be able to move. By far the best thing, it's a hard muscle to get to. It's underneath the bone, in through here. The best thing I have seen for this is dry needling. You can take a needle and we can go very easily, very gently through this little space and release the tension in that pterygoid muscle so that we take the pressure off of the joints in the jaw. There are ways that you can retrain this. One of the easiest ones is to get in a mirror and keep your tongue on the roof of your mouth. Smile, line your teeth up. So slide your bottom jaw forward to get to where your teeth are touching tip to tip. And then keeping your tongue on the roof of your mouth, watch as you open and try to keep your jaw perfectly aligned. If you start to get off, stop and bring it back to midline. Do this really slow, almost excruciatingly slow, to be honest with you, in the beginning. We want to retrain all the muscles to keep your jaw in midline as you open and close. So we're re-coordinating this. If you do this with treatment where you're releasing tension in the pterygoids that are dysfunctional, it's a big statement. I have almost never seen jaw pain that is related to pterygoid dysfunction not go away. Clicking, popping, locking, any of that stuff can be highly related to dysfunctional pterygoid tension. And when we release that tension and tell your body to start moving the jaw symmetrically from both sides, the pain gets better, the locking gets better, the pressure on the capsule or the joint gets better. So it's not always that the pterygoid on the same side is causing it. It's very common that the joint compression is what you feel and the pterygoid on the opposite side is what's actually causing your problem. Get it checked out, but this is a very weird muscle that sounds like a dinosaur and no one knows about that could be causing your jaw pain. So might be your pterygoid. It's worth looking at. Ask your doctor, ask your dentist, ask your physical therapist if they think that that's involved in your jaw pain. And now you have an answer to your treatment. So you can kind of go forward and get some relief. So I hope that helps somebody out there. Tell your friends about the pterygoid. Have a good day, everybody.